away, go away. Okay. Nope, that one's mine. There we go. Okay, so triangles of the neck. I mentioned this yesterday. Triangle is a loose term when it comes to these areas of the neck. Many of them are three-sided, but on occasion you have a four-sided triangle, so fun. So as I mentioned before, here's your anterior triangle, and here's your posterior triangle. And there's actually triangles within each of those areas, so we're going to end up going over them. You can see here's your sternocleidomastoid, helping to create the posterior border of the anterior triangle and the anterior border of the posterior triangle. Okay, so when it comes to your sternocleidomastoid, it helps with movement of your head. You can see how you have lateral flexion with rotation, you have extension. So it's like, it helps to move your head all over, and they're pretty strong and like powerful muscles in order to help you to do that. However, when those muscles get damaged or paralyzed or fibrosed, you end up with a condition called torticollis. So you can see how, looking at this patient, their eyes are not on a level plane. They're actually tilted down along with like the line of their lips. It looks like they're twisting their head over, and that's because they are. So here is left-sided torticollis, where this muscle is either paralyzed or fibrosed. You can see in this child, they have it as well. This is from your more blue boxes. So this can happen during delivery if there's an injury, or if you just have some damage to that muscle and then it heals improperly, you can end up with torticollis. So it's like they actually like have a twisted neck at baseline. So this is just the person's like the position of their head at rest is at this tilted angle. So that's torticollis. The way that you can figure out which one it is their chin is going to point away from the muscle that is paralyzed or is damaged. So wherever way the chin is pointing, it's the opposite muscle. So you can see in this child, the chin is pointing to the child's right. So it's the left muscle over here. That's the issue. Okay, so go away, taskbar. There we go. So muscles forming triangular boundaries. So in this Netter picture, you see these colored triangles overlaying a Netter plate. And this is the triangles within the triangles. So you can see how here is our anterior triangle. And now the subdivision of the 4 triangles within the anterior triangle are shown. So here's your submandibular triangle. Here's your carotid triangle. Here's your submental triangle. And then here's your muscular triangle. And this is the one that's 4-sided. Versus in your posterior triangle, they actually don't show very well the two, but I mean, they're easy. So you have triangle up here, and then border with the Myelohyin muscle and this triangle down here. But we'll go more into that. Oh, so now for her animation, she's like drawing them in for you. Okay. So for posterior triangles of the neck, again, the separation is that Myelohyin muscle, and I actually have my own triangle slides. So I pull this up real quickly just to show you a little bit better. That's anterior, just starting with posterior. There we go. So you can see how here, for your posterior triangle, the border is this omohyoid muscle, the inferior belly. And so inferior to this muscle is your subclavian triangle, also known as your omoclavicular triangle. And then superior to this muscle is your occipital triangle. So these are the two triangles that are within your posterior triangle of the neck. And I will send this triangles PowerPoint along with the video today. So superficially, you can see sensory nerves coming out that we mentioned before. So you can see your greater auricular nerve, you can see your lesser occipital nerve, you can see your transverse cervical nerve, and you can see your supraclavicular nerve coming out. As well as, can you see, does it show very well? No, because these are all superficial. Okay. So yeah, so sensory nerves coming out for sensation along this aspect of the neck. It's important to note that you can see how you have greater auricular here and lesser occipital. They've color-coded the areas where these sensory nerves are innervating. So transverse cervical here and supraclavicular. But going more posteriorly on the head and neck, you can see how you have greater occipital here and then third occipital here for innervation. And then finally, these cutaneous branches coming directly off of the posterior rami of C4 to C8. So these are just like unnamed cutaneous nerves coming out to innervate this area, versus you need to know the difference between greater occipital, lesser occipital, and third occipital, and where they're innervating. Okay. Superficial nerves of the neck, branches of the cervical plexus. Oh, we literally just talked about that. So this is just another picture showing it a bit deeper. Again, here's your sternocleidomastoid muscle. And then the nerves coming off for that cutaneous innervation. So here's your greater auricular, your lesser occipital, your transverse cervical, and then your supraclavicular nerves. And these are all for cutaneous innervation. Okay, contents within the fascial coverings. So this was a part of her last slide, but I'll repeat it again because cranial nerves tend to trip people up. So cranial nerve 11 is spinal accessory nerve, and spinal accessory nerve innervates your sternocleidomastoid muscle as well as your trapezius muscle. It's within an investing layer of fascia as it crosses the posterior triangle to enter and innervate the trapezius muscle. And it's sandwiched in between two layers of the investing fascia. Okay. So your cervical plexus. I know this looks a little bit daunting, but trust me, you'll get it. We've already talked about a bunch of the nerves that are seen here. So you can see how they've color-coded the nerves for you. So the ones that we've already talked about are the sensory branches. So you can see here, you have nerves going up. So we've got our, where were they? Here are supraclavicular nerves. Here's our transverse cervical nerve. Here's our lesser occipital nerve. And then here's our greater auricular nerve, all going out to do cutaneous innervation. So those are the green ones. Then if you look here, the orange are your cranial nerves that are shown in this area. We already talked about cranial nerve 11 coming down. That's their spinal accessory nerve to innervate trapezius muscle and then also sternocleidomastoid muscle, which isn't shown. They also show here cranial nerve 12, hypoglossal nerve. That's going to come into play when it comes to the cervical plexus and the Ansa Cervicalis. So cranial nerve 12 is your hypoglossal nerve. Literally hypo meaning below, glossal meaning the tongue, the hypoglossal nerve. Now, these yellow nerves here are loops that are in between, that are between adjacent anterior rami of spinal nerves C1 to C5. That is just to say this is a way for these nerves to connect with one another and allow for passage of the fibers. What really gets interesting is the purple ones that are labeled here. So these are your motor branches. These are the nerves that are going out to innervate muscles. And an important structure that you want to note here is the Ansa Cervicalis. So when we see Ansa, we think about a loop. We already had an Ansa pectoralis, and now we have an Ansa cervicalis. So cervicalis, cervical, Ansa in the neck, Ansa cervicalis. It's getting fibers from C1, C2, and C3. Now, when it comes to the Ansa cervicalis, note how C1 is giving fibers towards this like anterior portion of the loop versus C2 and C3 is giving fibers to this posterior portion of the loop. And they're showing these nerves going off and innervating different muscles. And you'll learn as you learn the muscles of the neck, what nerves innervate each one of them. But you can see like the nerve fibers going off to innervate the muscles here. So here, this big loop is your Ansa cervicalis. Okay. So cervical plexus. So once again, there's a bunch of nerves in this area, and this is just like another plate showing you it in a different form. But again, here is our greater auricular, our lesser occipital nerves going for cutaneous innervation. You can see here is our Ansa cervicalis. It's a big loop. C1 fibers coming more for the anterior portion versus C2 and C3 contributing more in the posterior portion. And then the nerves branching out to go to their individual muscles that they innervate. And you can see how this Ansa cervicalis is sitting on top of your IJV and your common carotid artery. Okay, so getting more into the triangles, let's talk about our subclavian triangle. So subclavian, recall like clavian meaning clavicle. So here's your subclavian triangle. Its borders are the inferior belly of your omohyoid, the middle third of the clavicle, and the posterior border of your sternocleidomastoid. So this little guy right here is your subclavian triangle. Within your subclavian triangle, you will have the subclavian artery and branches coming off. You'll have the subclavian vein, and then the trunks of your brachial plexus. So those are passing through this area. So subclavian triangle, subclavian artery, subclavian vein, and trunks of your brachial plexus passing through there. Okay, and you can see a better picture here. So this picture I think of more for thorax when you eventually get to your thorax section, because this is your lungs here, these purple. And you can see how the apex of the lungs actually comes up pretty high. So your clavicle would be, so here's where you'd have the middle edge of your clavicle, and then it would come across here. So this is the area that's deep to it. And then you can see because of the apex of the lungs there, if you end up stabbing somebody or you're if you get injured in that area, you actually run the risk of piercing the lungs because the apex of the lungs come up so high. They come up way higher than people realize. So if there's an injury to that subclavian triangle, you run the risk of injuring the lungs too. Okay, so here's our subclavian artery. Recall that the axillary artery is a continuation of the subclavian artery. From the subclavian artery, there are many branches. Just like our axillary artery, subclavian has 3 parts. So in the first part of your subclavian artery, you'll see the vertebral artery branches off. And the vertebral artery actually travels up through openings in your spinal column to go to your brain to give blood supply to your brain. It's one of the two contributors to what's called your circle of Willis, which you'll learn more about later when you get to like more head stuff. But for now, no, here's your vertebral artery, a branch off of your subclavian artery. Okay, I'm gonna come with another mnemonic for y'all, because when it's a lot of information like this, mnemonics are a great way to chunk the information. When I was learning the branches of the subclavian artery, we chunked the information with the mnemonic vitamins C and D. So vitamin standing for vertebral artery, internal thoracic artery, and the thyrocervical trunk. So it's the VIT of vitamins. And then the C was for the costocervical trunk, and then the D was for the dorsal scapular artery. So vitamin C and D was the mnemonic that me and my classmates used to try and chunk this information together. So first branch off of subclavian, vertebral artery. Second branch off of subclavian, internal thoracic artery. You can see it coming down here, deep to the bones. And then third branch, your thyrocervical trunk. Excuse me. Now, your thyrocervical trunk does have, branches coming off of it, because whenever you hear trunk, know that there are more branches to come. She doesn't have them labeled in this picture, so we'll get to them later if she brings them up again. So first part of your subclavian is the vitamin part, vertebral artery, internal thoracic, thyrocervical trunk. For the second portion, it's your costocervical trunk. So that's the C. And for the third portion of your subclavian artery, dorsal scapular artery, that's the D part of it. So vitamin C and D. So structures that cross in the floor of the posterior triangle. So your phrenic nerve actually travels through your posterior triangle, and I believe it travels on top of the middle scalenes, I think is the muscle. I'd have to look it up though, but I know it's traveling on top of a scalenes muscle as it's making its way down to go innervate your diaphragm. Let's see, what else is important here? Oh, and this is your transverse cervical artery. This is one of the branches off of your thyrocervical trunk. And then here's your suprascapular artery, another branch off of your thyrocervical trunk. So here's that thyrocervical trunk, your suprascapular artery, here's transverse scapular artery. And then here's your phrenic nerve deep to them. Okay. Another picture of your subclavian triangle, also known as your omohyoid triangle, because it's literally the inferior belly of omohyoid that's creating it, because it's that superior border for it. So you can see your subclavian vein, your subclavian artery. I think this is trying to show the phrenic nerve traveling down. And then here is, let's see, I think this is supposed to be suprascapular artery. And then you can see, so they have dorsal scap labeled over here, but that's supposed to be further down. Interesting. Okay, so clinical correlation with this area is subclavian vein puncture. This is from a Moore blue box. So when you're trying to do this, this is the method that they use to figure out where to go for access when they're trying to pierce into your subclavian vein. It's feeling for that jugular notch, the manubrium, and then your thumb at the end of the clavicle. And then these particular, like, I think that's your middle finger that's resting on the sternocleidomastoid. And you're going below the clavicle when you do this. Okay, so your anterior triangles. Your anterior triangle is more complicated because instead of only having 2 triangles, it has 4. So first off, the basic borders of your anterior triangle, your sternocleidomastoid posteriorly, the mandible superiorly, and then this imaginary midline medially, anteriorly. So she talks about, again, the sternocleidomastoid and the inferior border of the mandible. But she also talks about the mental symphysis, so like the point of your chin to the jugular notch as being the boundaries of that imaginary midline. So the point of your chin to your jugular notch is how, like, from point to point is how you draw that imaginary midline. So the subdivisions of the anterior triangle, there are 4 of them. So we'll go over these again. You have your submental, literally meaning below the chin, your submandibular, below the mandible, your carotid, and your muscular. So this is the front of your neck. Here's that imaginary midline that we're drawing down. So your 2 different anterior triangles of the neck. All right, I'm actually going to switch to my slides for a second. Okay. I really like this picture when it comes to visualizing the 4 anterior triangles because I think it's a little bit easier to see them. So here's your submandibular versus here is your submental. Here's your carotid, and then here is your muscular triangle. For me, when I was learning this, I actually drew out the triangles and the borders in order for me to better understand their dimensions, like how, like what bordered what and how you label each. So I would suggest when you're studying these, actually drawing out the different borders and how the triangles are divided. Okay, so structure superficial to the anterior triangles. So obviously your skin, and then fascia. Investing fascia roofs over the submental and muscular triangles. So here's your submental triangles, and then here are your muscular triangles. And literally it's called the muscular triangle because there's muscles in them. Those are where your strap muscles are. And then also the anterior jugular veins and sometimes a jugular venous arch are located in the muscular triangle, which is what they're showing here. All right, so your muscular triangle, oh, she didn't give you a list. Your muscular triangle contents just has muscles in them. Here. Yeah. So when you're looking at your muscular triangle, it is just the muscles in this area. So your thyroid muscles, your sternothyroid muscles, and then your superior belly of omohyoid muscle. For your your suprahyoid muscles are what are going to be involved in your submental and your submandibular triangles. We went over the suprahyoid muscles yesterday, but I'm going to go over them again just so they can stick in your brain a little bit better. So notice here is your digastric muscle. So digastric meaning 2 bellies. So you have an anterior belly And then you have a posterior belly of digastric. And then here is the little fibrous sheath that it like passes through so it can make that turn. So it can make this V here. So anterior versus the posterior belly of digastric. Also in this area, you have your stylohyoid muscle. You can see better. Here's that styloid process, that projection of bone coming out of the skull. And then here's the hyoid bone. And this muscle literally connects the hyoid bone to the styloid process. So it's the stylohyoid muscle. Looking underneath your mandible here, you can see the myelohyoid muscle. And here's like this median raphe where the two muscles connect. So when I was learning about the myelohyoid muscle, we would call it the fan muscle because it would fan out and they were just connected at the middle. But they're helping to form the floor of your mouth. Deep to the myelohyoid muscle, you can actually see the hypoglossal muscle. Did she mention geniohyoid? No. Okay. So here's a better picture of your myelohyoid muscle. And you can see how, like, why we call it the fan muscle. So here's that median raphe where the two muscles are connected. And you can see how they're attached to both the hyoid bone here, as well as your mandible coming across it like a fan. Again, here's our anterior belly of digastric, and then the posterior belly. Here's the stylohyoid muscle. And then deep to the myelohyoid muscle is your hypoglossal muscle. Okay, so we talked about our suprahyoid muscles. Here's our infrahyoid muscles, our strap muscles. So again, here is omohyoid, superior versus inferior bellies. Here is our sternohyoid muscle connecting the sternum and the hyoid bone. Here is our thyrohyoid muscle connecting the thyroid cartilage and the hyoid bone. And here is our sternothyroid muscle connecting the sternum and the thyroid cartilage. A lot of these muscles in this area are just like the names tell you what are the two areas that they're connecting to, which is pretty helpful. Okay. Innervation of your infrahyoid muscles. So I mentioned this before. Here is our cervical plexus along with our Ansa Cervicalis. So you can see fibers from C1 coming down and contributing to this anterior portion of the Ansa Cervicalis, and then fibers from C2 and C3 coming down and contributing to this posterior part. She has them labeled here, the superior loop versus the inferior loop of the Ansa Cervicalis. And you can see how the nerves coming off of this area are going to innervate those different muscles. So again, here was that hypoglossal nerve I mentioned before. Hypoglossal nerve. And then from C1, you can see nerve to the thyrohyoid muscle and nerve to the geniohyoid muscle coming off of this area. Fibers from C1. On our superior loop coming down, you can see nerve going to the superior belly of omohyoid. So off of the superior loop, you get the nerve going to the superior belly of omohyoid. And then you have nerves going to the sternothyroid muscle, the sternohyoid muscle, and then nerve to the inferior belly of omohyoid muscle. So for that inferior loop, you have the nerve going to the inferior belly of omohyoid. And all these are coming off of your Ansa cervicalis or directly from fibers from C1 that pass through. So when it comes to innervations of these muscles, it's a little bit easier to remember the name of the nerve because the nerve is just nerve to insert the muscle. You're going to want to look up, though, what nerve roots it is, because that will help you remember, is it superior loop versus inferior loop of Ansa cervicalis. Again, this one's from Grey's Anatomy as well. showing our Ansa Cervicalis. So here's that superior loop, superior root. Here's the inferior loop. So C1 coming down, and then C2 and C3 to create our Ansa Cervicalis. And you can also see here's cranial nerve 12, hypoglossal nerve coming down, and then going to innervate the tongue and the muscles beneath the tongue. So literally hypoglossal. Now you can see here, they've pointed out, here's the nerve going to your geniohyoid muscle. Here's your nerve going to your thyrohyoid muscle. Nerve going to the superior belly of omohyoid. Nerve going to, I believe that's sternothyroid muscle right here. Nerve going to sternohyoid muscle, and then the nerve going to the inferior belly of omohyoid. All right, so finding the Ansa cervicalis in this picture, I believe it's right here. So you want to look for the loop that's lying over top of the blood vessels. So this would be contribution from C1 coming down, and then C2 and C3, if I'm right. I think I'm right. And you can see how here's hypoglosso continuing up versus here's nerves coming down to innervate, I believe, sternohyoid. Yep, and that was our loop. Okay. Anatomy of the emergency airway at cricothyrotomy. So yeah, this is an interesting jump to make at this point, but it's in the area, so we'll talk about it. When it comes to emergency airway, we would put these into place when the person is unable to breathe on their own, or we are unable to get a tube down their throat to help them breathe. So we've been talking about the hyoid bone because of all the muscles that are attached, and how we've also mentioned the thyroid cartilage, which is inferior to your hyoid bone. So below your thyroid cartilage is your cricoid cartilage. And in between the two, you have what's called the median cricothyroid ligament. So this is connecting the two cartilages together. This is one of the ligaments that's involved in so it's interesting, this area, because this is more of a larynx and pharynx topic, because of like the intonation of your vocal cords and getting you to breathe versus whisper and stuff. But the important point here is that you need to know that it's the median cricoid ligament that you would cut in emergency airway. So on this picture for this particular patient, you can see the thyroid cartilage here, and then you can see the cricoid cartilage here. And in between the two is going to be your median cricothyroid ligament. If you cut here, this gives you emergency access into the airway. So you'd then be able to put a tube here in order for the person to breathe. This is the area that you put the tube in with like the colloquial tube called the trach. So when you have patients, say in the ICU, I believe a patient's only supposed to be on a ventilator for like more than 10 days or something like that. And if it's going to be more than, no, it's either 10 days or 2 weeks, something like that. But if it's going to be extended period of time, you're supposed to put in this tube because it's more like safe and more healthy for the patient. So you would cut here and then put the tube in here, and this would allow access to allow the patient to breathe properly. So this is an emergency airway. Please do not be like Grey's Anatomy and do this, though. Okay, so now we're going to talk about our submandibular triangle. So it's highlighted here in the red. Submandibular literally meaning below the mandible. And you can see how in this picture, you can see like the green lymph nodes, the pink submandibular gland, and then you also have fascial vein is coming through. So this is a netter plate, and talking about our submandibular triangle. So some important points in this plate, just to help you like for later on. You can see again, we talked about yesterday, your parotid gland is above this area, but your parotid gland is really big, way bigger than you would actually realize. And it's the biggest gland for providing saliva to your mouth. There's also your submandibular gland here, as well as your sublingual gland. So those are the three big glands for production of saliva for your mouth. So you can see here how fascial artery and vein are both passing in this area of your submandibular triangle. And fascial artery is a branch off of your external carotid artery. You may or may not need to memorize the 8 branches of your external carotid artery. We'll see if she throws in that picture for y'all later. Okay, so now your carotid triangle, which is here. So the borders of your carotid triangle, you can see posteriorly you have the anterior border of your sternocleidomastoid. Superiorly, you have that's wrong. She has these flipped. So superiorly, it should be the posterior belly of digastric, and then inferiorly, it should be the superior belly of omohyoid. Oh, she just lists them. Oh, okay. I was about to say, yes. Sorry, I thought she was saying the superior border. Read that wrong. But yes, so your posterior belly of digastric is the superior border, and then the superior belly of omohyoid is the inferior border of this triangle. So your carotid triangle is named such because your carotid sheath is in the area. Recall that our carotid sheath, it is investing around our internal jugular vein, our common carotid artery, as well as our vagus nerve, and lymph nodes in the area, the deep cervical lymph nodes. And the Ansa Cervicalis, is this saying it's inside of it? I thought it was on top of it. All right, I'm going with what she's saying there with the Ansa Cervicalis. Now, when it comes to your common carotid artery that then splits into your internal and external carotid, here's your internal, here's your external carotid. In this area of the split are 2 important structures. There's the carotid body, and then there's the carotid sinus. The carotid sinus is this like area of the artery that's actually bigger than the rest. Like that's why it's called a sinus, is that that caliber of the artery is actually bigger in the area. And it is bigger because you have baroreceptors there, which are pressure receptors that respond to changes in blood pressure. So as your blood is being pumped out of your heart into the aortic arch, and then on the right side is going to go to your brachiocephalic trunk. And then from your brachiocephalic trunk, the brachiocephalic trunk is going to bifurcate. And one of those branches is your common carotid artery here. And then your common carotid artery will bifurcate into your external and internal carotid artery. So as that blood is being pumped by, this carotid sinus is sensing the pressure, like the actual pressure of the blood as it's passing through. So if you the sinus, because it has those pressure receptors, it's going to be able to tell if the blood pressure is too high. And if you have pressure that is too high, it's going to kick in a reflex that then decreases your heart rate because it's trying to keep like the blood pressure at a balanced state. However, there's an interesting thing that happens that if you apply manual pressure, to this carotid sinus, it can drop your heart rate so low that you faint. So this is the carotid massage that can happen. This is what, like, oh, there's something in the chat. Oh yeah, that's fine. So yeah, when you apply pressure to the carotid sinus, you can trigger this reflex because the baroreceptors, those pressure receptors, will note the increased pressure, thinking that it's coming from the pressure of the blood being pumped from the heart and not from like an external source, and it will drop your heart rate and then you can end up fainting. So that's carotid massage. The carotid body, however, has chemoreceptors. So the chemoreceptors are going to be able to detect the levels of oxygen and CO2 in the blood. And as you have too little or too much of either one, it's going to stimulate your respiratory rate. The respiratory rate, the depth of how you're breathing, like if it's short tachypnea, where you're like hyperventilating, or deep breathing. And it can also affect your blood pressure and the heart rate. So these are two different areas, like two different areas of senses, like sensation that you have in your body. And it all has to do with your sympathetics. So mentioning cranial nerves again. So cranial nerve 9 and 10, 9 and 10 are both involved with both your carotid body and your carotid sinus and the sensation. So like sensing the pressure, sensing the change in the amount of O2 or CO2, and then promulgating the response in your body to those changes. So cranial nerves pop up a bunch, just FYI. Okay. Carotid arteries within the vicinity of the carotid triangle. All right. So again, here's our carotid triangle. Here's our common carotid artery, and it branches into the internal carotid and the external carotid. So the internal carotid is the other, I just want to make this note, the internal carotid is the other major artery that contributes to the blood supply in the brain. Remember before how your vertebral artery branched off of your subclavian artery and it travels up to the brain? Well, vertebral artery contributes to the blood supply in the brain, and your internal carotid artery contribute to the blood supply in the brain. Between the two of them, they're giving arterial blood to what's called the circle of Willis. And the circle of Willis is the actual like network of the blood supply in the brain. So just want to make that note since we see it here. For your external carotid artery, so I mentioned how it has 8 branches. So 2 of those branches you can see, well, a couple of those branches are labeled here. So you can see how you have superior thyroid artery branching off of your external carotid. And then you have your facial artery branching off of your external carotid. You also have lingual artery branching off of your external carotid, as well as occipital artery. So those are the ones that she's pointing out here for y'all. Okay. And again, our carotid triangle, and you can see here is our common carotid artery that bifurcates into internal and external carotid. Here's that Ansa Cervicalis sitting on top of our carotid arteries. And then here are the different branches coming off. Here's superior thyroid artery. Here's, where's facial? So lingual and facial come off at similar heights, but it's labeling this one as, oh good, it is facial. Because I'm like, facial comes off and then lingual. All right, oh, and this is a drawing. Okay, so sternocleidomastoid muscle, superior belly of omohyoid, posterior belly of digastric. Here's your common carotid artery, your internal carotid, your external carotid, superior thyroid, lingual, facial arteries, occipital artery, and then ascending pharyngeal is back here as well. And you can also see your hypoglossal nerve passing in this area, and then coming posterior and deep to it, it looks like, is spinal accessory. Oh, because it's passing along. So it's passing over the internal jugular vein. That's what's happening there. Okay, good drawing. All right, so venous drainage. So already talked about how your vertebral artery and your internal carotid artery give arterial blood supply to the brain. Well, venous drainage of blood coming out of the skull is via your internal jugular vein. You can see that right here. Important thing to note. So actually, I won't get too much in that. So yeah, here's your internal jugular vein. It begins at the jugular foramen as a continuation of the sigmoid dural venous sinus. Don't worry too much about this until she gets into like the venous blood supply in the brain. Just know that the IJV is a continuation of the sigmoid sinus, and it starts at the jugular foramen. And foramen just means hole, and it's called the jugular foramen because it's big, so it's the jugular foramen. And it ends by joining the subclavian vein to form the brachiocephalic vein, which I've mentioned to y'all before. So our subclavian vein is coming from the upper limb. Here's our IJV coming from the head. And when they come together, they make your brachiocephalic vein. And then the two brachiocephalic veins then join together to make your superior vena cava. And your superior vena cava empties into the right atrium of the heart. Okay. Cervical portion of the sympathetic trunk. Okay, so this is when we get to talk about the sympathetic ganglia. So you learned about sympathetics originating in your spinal cord at the IML, the intermediolateral gray horn. So those columns inside of the thoracic spinal cord that are giving you your origination of your sympathetics. However, to get sympathetics to the head and neck, what ends up happening is that their ganglia are much higher up. So the sympathetics for the head, they actually synapse here at the superior cervical, well, so you have a superior, a middle, and an inferior cervical ganglia. And then after they synapse, the sympathetics themselves travel along arteries to get where they need to go. And they sort of look like this spider webby type mesh over top of the arteries. So they're gonna come from the spinal cord, travel up the sympathetic chain, synapse at these ganglia, and then travel along arteries to get to wherever they need to innervate for their sympathetics. Okay, and now your submental triangle. So you can see how here's for your boundaries. Here's your hyoid bone, your right and left anterior bellies of digastric, and then the myohyoid being the floor of the triangle, and then the mental symphysis is the apex, which is here. So the point of your chin. Oh, okay. And that was the end of her PowerPoint. Let me pop over to my triangles PowerPoint and see if there's anything that I wanted to make sure y'all knew. So we already talked about spinal accessory passing through the posterior triangle because it's innervating sternocleidomastoid and trapezius. And that makes it vulnerable to injury because it's so superficial. She might have mentioned blood supply that much for the posterior triangle. Oh, here are the like branches of your external carotid artery. I don't know if she's going to make you memorize all 8. when we took anatomy, we had to memorize all 8, but until she tells you otherwise, like, because it can be a bit daunting. However, I do like this picture because it shows the different branches pretty well. So you can see here's your common carotid, there's that carotid sinus, the carotid body would be right in here. And then here's your external carotid artery. And then for the 8 branches, it's superior thyroid, literally going to the top part of the thyroid gland. Ascending pharyngeal, which branches off posteriorly. Your lingual artery, your facial artery, your occipital artery, your posterior auricular artery, so going to the back of the ear, and then your maxillary artery and your superficial temporal artery. The 2 terminal branches of your external carotid are your maxillary artery and your superficial temporal artery. But like I said, I don't know if she's going to make y'all memorize those. That was just something that we had to learn. Okay, so it's 11:53, so I'll just go ahead and stop. I don't think there's anything major in my review slides that she didn't cover in hers. Mine is way more like show pictures, point out triangles.